So there's other ways to lose weight. Having an egg that's full of fat and protein, having meat, having cream, those things are highly satiated. They have calories, but you don't get hungry for a long time. So I used to eat Raisin Bran every morning with blueberries on it. I thought that was healthy. Turns out there's 17 grams of sugar in Raisin Bran. And when I switched to bacon and eggs or just not having breakfast because I wasn't hungry, for me, that had the effect of improving my metabolic health. The Breakfast Cereal, one of the books by Terence Keeley is called Breakfast is a Dangerous Meal. So the dietary guidelines say you have to have breakfast. And maybe for children, breakfast is key. They have much higher metabolisms, they're burning energy, but snacking all day, which is what governments suggest, and now sports events, moms are chasing around after their kids with little snacks as if they can't get through 5 hours. Um, it's 3 meals a day or 2 meals a day turn out to be more traditional than snacking all day long. And in the Bible, they mention fasting some 60 times.
Yeah.
Going a day or two without eating for adults, it seems crazy to those of us who've been raised on never even, never going too long without a snack. But that's the metabolic flexibility that allows us to burn our own body fat. So
Yeah.
each of these things is controversial, but for students to research it, the question really is what works for each person? And is their doctor aware of the research on time restricted eating?
Yeah. And one of the things I'm doing right now is I'm doing intermittent fasting twice a week. I will take in no calories until dinner time and from the day before. And so I'm going about 20 to 22 hours twice a week without eating. And I'm finding I'm not hungry. I could actually have, when I start to eat in the evening, I'll eat kind of slowly and I'll eat proteins and stuff like that in order to get myself satiated. But there are times when it's like I could probably make it till the next day, and
Yeah.
because I'm not hungry. And so I fasted on Monday, and then had a light meal on Monday evening and ate till I was full. And then Tuesday morning I had bacon and eggs for breakfast, and then didn't have time to eat lunch, and then had club last night and didn't have time to make something for dinner for me because we don't have club at my house anymore. It's like I wasn't even hungry, and so I didn't need anything. I got home and had a couple of had a little bit of something when I got home, but you know I wasn't hungry, and
Yeah.
so I've been doing that for now. It's about 2 months that I've been doing this. I'm cinching up my belt a little bit, and I'm
Yeah.
feeling more energetic. I'm feeling I had eggs and bacon this morning, feel great, and drink a lot of water, and just to make myself kind of feel full. But this has kind of been a habit of mine now and I'll probably continue this, and for quite some time.
Yeah. So it's very interesting. I have a similar situation where over time gain metabolic flexibility where when I travel, I don't eat often because I'm on an airline and they offer me pretzels or whatever it is they offer now, and I don't eat that. It's easy to have a cup of coffee and just go through the day. But these are things that people used to do in ancient times or earlier times. Um, and when I grew up, we'd have dinner at 6 and then we wouldn't eat again till breakfast. I mean, that's a 12 hour, we would break the fast at breakfast. And
Right.
so that's a 12 hours without eating. And I don't know. So these are habits. The story, what's the quote on habits? The chains of habit are too light to feel until they're too strong to break. That's a negative take on habits, but good habits also follow this. It turns out that if you don't eat potato chips or cookies for a time, you sort of lose your craving. Your taste buds for sugar will reset. Isaac Summers, a former debater, has a sugar website. He's just cut out sugar decades ago, and it turns out that sugar can be a poison for a lot of people, excess sugar. The original carrot cake in Europe, why would you have a carrot cake? Well, carrots were the sweetest thing they had for
Yeah.
poor people in England, so they made a cake out of carrots. Our carrot cake today has enough sugar to knock us sideways.
Yeah.
So it's learning these things, and the government, the one of the problems of having the federal government involved in providing health care, apart from the fact that they're taking taxpayers' money and doing this and that, is they're doing what the experts at the top think is right, but when they're wrong, the entire country goes the wrong way. And that's the argument. That's regulatory capture, but it's also the views in academia. I mean, most economists think the Federal Reserve is a great organization that manages the money supply so that otherwise we would have chaos of booms and busts. But students, when you have a money topic, students can debate the history and research the Federal Reserve. Similarly, the federal government is trying to control. In fact, last year's topic was energy policy, and the government has been funding intermittent energy and wind and solar. And now it's healthcare. The government is funding intermittent energy carbohydrates that give us a boom
Yeah.
and bust in our blood glucose levels. It's bad energy that's damaging everyday people.
Yeah, and the founders understood this concept from the very beginning, and that was why the whole process or the setting up our government in a federalist, the federalism aspect, where the federal government was supposed to only take care of things that would be beneficial to the nation as a whole. And not the day-to-day lives. And that's why they gave them in Article 1, Section 8, the 17 enumerated powers for this is what the federal government has the authority to do. And then the Bill of Rights was in there to say these are the things that the federal government are prohibited from doing. And especially the 10th Amendment, anything not specifically given to the federal government in their authority is reserved for the states and the people. It would be much better to have 50 separate experiments on nutrition and health and healthcare than to have one blanket policy that affects everybody, and we find out, well, that's not really good, but there's nothing so permanent as a temporary government policy.
Right.
And so once they set that into motion, it takes a long time to have that overturned or changed or anything like that. It'll work. We'll keep putting money into it until it works, is what their
Yeah.
philosophy is. And so we need to get the government out of healthcare and let the states and the individuals take that over.
Right. And for debaters, advocating federalism, I think, is a strong case. Better not to use the term experiment. We don't like to experiment on people, but it's a searching process.
Right.
Like Florida just announced, I think yesterday or last couple of days, to not recommend the latest boosters for young people. They just say, look, the evidence doesn't support, given the risks involved of the current Omicron COVID, it's not advisable to take the boosters. Well, that's at odds with the federal, and very few people are taking them now, but
Yeah.
you've got the federal government still promoting them because of something that was in the past when it was, so that whole, and I don't know how students are going to deal with concerns about the vaccines and COVID and things like that in currently, because that's sort of a public health issue as opposed to just a regular health issue. But the decision on medical advice to give young people, uh, those decisions should be made by your doctor, your research, and each family has to. I mean, the challenge with going to a doctor is the doctor knows more about medicine than you do. That's a
Yeah.
good thing, but the same problem of going to a car mechanic or an auto dealer, used car salesman, they know more about the car than you do. It's called asymmetric information. But it's your responsibility to at least search for doctors, search for medical theories, search for views that are based by the most recent science on what medical procedures. They say something like 80% of medicine isn't backed by evidence. It's not evidence-based. So how many medical procedures take place that really don't have powerful science on their efficacy backing them up? And that's, we should at least not have federal funding of procedures that aren't evidence-based. In Medicare, Medicaid, veterans hospitals, any other federal health, they should pull back on excess medications and procedures that lack evidence.
Yeah. I like what Mike Winther said years ago, that there's no problem so big that the free market can't handle it, and no problem so small that the federal government can't absolutely screw it up.
Right, right.
And that's
Yeah, mistakes
that
happen.
happens.
Yeah, and it's important to realize huge mistakes happen in the private sector. People
Yes.
make mistakes. Good people make bad mistakes. Bad people sometimes do great things, even if it's
Yeah.
not their intention. I mean, things go. You want to evaluate what happened. And in the private sector, when a company comes out with a new procedure, if it fails, it fails, and they should, lose money or go bankrupt. There's a case in Reading of a doctor in a medical clinic that was incredibly successful with their heart procedures. They were doing all sorts of heart operations, and they had the highest survival and success rate of anybody in the country. So people were applauding for a while until they realized they were doing these procedures on healthy people, on people who
Yes.
didn't need the procedures. Our scanning technology is so advanced that every lung, every heart has problems that could be treated. That's why so much medical expenses is spent on people in their 80s and 90s because they have all sorts of problems that could be treated by a surgeon. And, discretion is the better part of valor. I don't know what the saying is in the medical community for that, but sometimes just because you can do it, you shouldn't. And who's going to decide whether it's needed or not?
Right.